In July 1993, Nigeria's Federal Ministry of Health gave the report that 5.5 million Nigerians were affected by high blood pressure. Today, the World Health Organization reports that 1 out of every 3 persons in the world is hypertensive. And of that total figure, a staggering 56 million Nigerians suffer from the silent killer that is hypertension. Scary. On this episode of Channels Discovery, we examine the nature, causes and effects of hypertension. We examine the many reasons why Nigerians, young and old, are so prone to this condition, why it lives up to its label as a silent killer, with its ability to creep up on an unsuspecting population despite the best efforts of medical bodies at home and abroad. I'm James Laide, and you're watching Channel Discovery. Hypertension is the leading cause of stroke and a major cause of heart attacks. According to the World Health Organization's Global Status Report, Africa has the highest count of hypertension cases, estimated to be 46% of adults aged 25 and above. When we bring that home, right here in Nigeria, it translates to over 56 million Nigerians suffering from hypertension without even knowing. My first point of call was the Community Hospital, Lagos State University Teaching Hospital, where I met with Dr. Awubusuyi, a cardiologist who seems to see the heart of the matter. Doctor, what exactly is hypertension?
Well, hypertension is that disease condition in which the blood pressure of an individual is higher than normal.
How difficult is it for somebody, say, who just walked in off the street, coming in here to LASUTH, and they wanted to get a reading on their blood pressure? How easy is it, or difficult?
It's very easy, and as part of the effort of most hospitals in screening hypertension, practically all patients who register have their blood pressures taken as part of
the vitals,
the vital sign.
You find that a lot of Africans, Nigerians in particular, don't really like going for routine checkups. Like we don't want to know what's wrong with us, as long as there's nothing, that's serious and we can get out of bed. We really don't want to know if we have any condition until it's too late most of the time.
Yeah. It's a very serious issue that's the medical community is giving us a lot of concern. I think it's also part of our perception of the disease process, and the fact that many people also have this denial. You are told you have an illness, and the next thing is to probably say you reject it or some kind of yeah, and that's actually hasn't helped issues that yes, you've made a diagnosis, you've given some counseling as to how severe the disease is, what needs to be done, and the patient goes home and the next thing is he rejects.
But heaven helps those who help themselves.
Yeah, heaven helps those who help themselves, but the fact that he has rejected it and not taken the appropriate therapy doesn't sort of exonerate us because if he develops stroke, for instance, it will affect his family directly. It's going to affect the community in one way or the other. So we still have that responsibility to ensure that he sees reason as to why it's necessary to, get treated.
The World Health Organization, the Nigerian Heart Foundation, LASUTH, as well as other health NGOs have been pushing for, more blood pressure awareness with Within Nigeria, Africa at large, why do you think that Africans are not really taking their blood pressure that seriously?
Well, I guess we still need to do more. We still need to make people realize that although you don't have symptoms, hypertension is still very dangerous, and that it could lead to very severe complications that can cause death. Even if the patient, doesn't die, the costs of managing those complications are quite enormous. The disease doesn't manifest itself clinically until either the individual takes his blood pressure.
Meaning there are no symptoms?
There are no symptoms. And occasionally, the patient just comes in with complications of hypertension, which are quite severe. So a patient who assumes that he or she is normal and carries on with his or her business can suddenly come down with a stroke because his blood pressure has not been checked for quite a long time. Yeah. And that's why it's called a silent killer.
All right, Dr. Awubusi, thank you very much for your time, sir. Thank you. Statistics carried out by the World Health Organization show that 1 out of every 3 persons around the globe are hypertensive, a situation which they say could become detrimental to the survival of mankind itself. In Nigeria, it's 4 out of every 5 adults. We needed to find out more about how to treat this devastating condition, so I went in search of expert opinion at Reddington Hospital, Lagos, a multi-specialist medical center in the field of cardiology here in Victoria Island, Lagos. Doctor, how serious is high blood pressure as a condition?
Hypertension or high blood pressure is one of the leading causes of heart and kidney disease that leads to the major complications of stroke, heart attack, kidney failure, heart failure. This results from end organ damage, vascular damage, blood vessel damage, especially the microvasculature or the very small blood vessels. It results in damage to the organs, such as the eye, which causes blindness. It can cause impotence, narrowing of the coronary arteries, which leads to heart attack, narrowing of the carotid arteries in your neck, leading to the brain, which can lead to stroke. In Nigeria, it's estimated that 57 million people have hypertension.
That many?
That many, with many still undiagnosed for a variety of reasons. Lack of access, ignorance, meaning that people don't want to know if they have medical conditions, including high blood pressure. So you could see that it's a huge public health problem in Nigeria.
And what sort of person is typically most at risk to have high blood pressure?
Well, men have a higher incidence than women. Obese people have a higher incidence than thin people. People that eat salty foods have a higher incidence than people that don't. People that smoke have a higher incidence than people that don't smoke. And people that lead a sedentary lifestyle, like many business people, have a higher incidence than people that exercise regularly.
So typically, what is the scenario in terms of, could you describe rather, the damage that high blood pressure could cause to the body, the human body?
Well, as I said, it does affect all the blood vessels in your body. And the ones that have involvement of the small blood vessels, for instance, might cause blockage, which can lead to damage to the retina, which can lead to blindness. In the kidney, the microvasculature or small blood vessels are affected, which leads to decreased blood flow to the kidneys, decreased function, eventually renal failure, kidney failure, which in order to live, we most likely would need to go on dialysis.
Wow.
So in Nigeria, it's one of the leading reasons that people are on dialysis is complications related to hypertension and then also related to diabetes. Okay, Sister Chica is doing a blood pressure reading on you now. You can see it's very quick and it's painless, a painless procedure. This is the actual procedure to take the blood pressure. You get a reading of one number over another number. The top number is called the systolic blood pressure, and the bottom number is the diastolic blood pressure. The systolic blood pressure measures the pressure in your blood vessels when the heart is contracting, and the diastolic measures the pressure within your blood vessels when the heart is relaxing. And those numbers are read out, for an example, as 140 over 90, which is the top limit of normal. If you're a diabetic, they generally recommend it's 135 over 95. And it's kind of an interesting story how they arrived at that number. Medical people did not arrive at that number. That was done by an insurance actuary who, when he was examining thousands of people that had a physical before life insurance policy, he found that people whose blood pressure was higher than 140 over 90 had a much higher risk of disease than those that had it lower. So it was actually done from a non-medical way that the insurers would figure out that, you know, these people are at higher risk, these people are at lower risk, and so the medical field adopted those numbers.
Okay, so what are my numbers, and am I healthy?
What was the number?
120 over 80.
Perfect.
Really?
Excellent, excellent numbers, yeah. 140 over 90 is what we consider the top limit
fit.
of normal. So, yeah, very good. Very
But I
good.
mean, the point is you need to do regular checkups in
Regular
order
checkups.
to make sure that you are
Yeah,
fit and healthy, right?
people over the age of 40 should get it done at least once a year.
At least once a year.
And if it's ever found that the blood pressure is elevated, then it should be done more frequently. Now, I think most physicians wouldn't actually treat you based on one blood pressure reading.
So you might have to come back for a follow-up.
Correct. Or maybe blood pressure readings in a neutral setting. So for instance, maybe somebody comes here for one reason, but they have a nurse at their workplace. So I would tell them, get some blood pressure readings at work with a nurse, you know, in a quiet setting, and then have recorded so that me or a physician can check those out. Now, one of the things that the problem we have is in Victoria Island with the traffic and business people being in a hurry. Sometimes you get people and they want to come in real quick and get their blood pressure checked. You know, the doctor told me to get my blood pressure checked. That's the worst thing to do. You come in, sit down, relax, and then have the blood pressure taken in order to get a valid reading.
So doctor, is high blood pressure preventable, and how is it treated?
High blood pressure is eminently treatable. 90 to 95% of people with high blood pressure have what's called essential hypertension, which means that it's part of their innate nature or their genetic makeup. So those people are prone to get high blood pressure. Now, there are modifying factors that can accelerate the onset of high blood pressure.
Such as?
Obesity,
Being
smoking, being overweight, smoking, having a sedentary lifestyle, actually living in an urban area versus a rural area. And that's not just for Nigeria, but that's across the countries.
Like increase in stress?
Increase in stress, change from a more traditional diet to a diet that's likely higher in fatty foods and higher in processed foods, which are all bad for high blood pressure. The other thing is salty foods increase the blood pressure.
And why is it referred to sometimes as a silent killer?
It's referred to this as a silent killer because very often people have no symptoms, and then they might go to a doctor's office or they might go to a screening, and all of a sudden they're noted to have high blood pressure.
Wow.
So it's not the type of thing that normally people say, Doc, I'm feeling badly, and so I need to get my blood pressure checked. It's the type of thing that you don't know about it.
Wow. Well, this is definitely going to make me take more precautions and try and live a healthier lifestyle. Dr. Susi, thank you very much for your time, sir.
James, there's no
Appreciate it.
problem. Happy to be of help.
With regards to healthcare in Africa, how affordable are these high-value services becoming to the average African?
At the moment, most Africans are embracing HMO, which is Health Maintenance Organization, a form of insurance where everybody pays for somebody else, and that is making it more available to the Africans. And the present health insurance at the national level is trying to use that to get many more people to be able to come up with affordable healthcare services.
So it's becoming more affordable.
It's becoming more affordable through the healthcare system of insurance.
Does Reddington see a healthier Africa in the near future?
Yes, I can foresee a healthier, Africa in the near future if this health insurance scheme is being embraced, as it were, by all. Then healthcare becomes more affordable, and the population that will key in will be quite a number.
Dr. Lawani, thank you very much for your time, sir. The global frequency of hypertension has been on the rise. From the year 2000, 972 million people were hypertensive with a prevalence rate of 26.4%. Unfortunately, this figure is projected to rise to 1.54 billion by the year 2025. That in itself is a major cause for concern, which makes one wonder how exactly high blood pressure prone patients deal with its liabilities. I chose to visit Mr. Gbenga Olayeye, Senior Marketing Director of an indigenous pharmaceutical company in Nigeria, Fitson Healthcare, to discuss the medical solutions available and how best the public can make the most of it. Good afternoon, sir.
Nice to have you in my office.
Thanks for having me. You have a lovely establishment here.
You mind if we walk around?
I would love to. Nice. If we were to assume that most pharmaceutical companies develop and market drugs for hypertension, why then is it increasingly prevalent here in Nigeria?
Well, I think the first thing we need to realize that there are many predisposing factors to hypertension. You have obesity,
being overweight.
Right, being overweight.
Right.
You have family history. So in other words,
Genetic?
if you have a family history, your parents are hypertensive, there's a huge likelihood that you're also going to develop that condition.
Oh, really?
Right, alcoholism consumption, right? If you consume too much of alcohol or smoke, right, you have an increased chance of having high blood pressure.
Okay.
Now, if you're also on certain medications, you can also, have high blood pressure. Those are basically what can, give you the condition of high blood pressure.
Okay. How difficult is it to actually get real medication, genuine medication, to people who need it here in Nigeria?
I think largely you'll have more authentic drugs than you have fake drugs. If you go to proper pharmacies, right, to purchase your drugs, you're assured because they get it from the genuine manufacturers and importers. But if you patronize quacks, or backdoor, drug outlets.
The street vendor who's just like by the bus stop with 100 pills on his tray.
Then you'll stand a very huge chance, of getting the counterfeit or substandard drugs.
Let's assume somebody watching now, doesn't know they have, hypertension or, high blood pressure. What's the first step for them to find out if they have it? And then if they find out that they do have it, what do they do?
We usually advise that when you get past the age of, 40, You know, you do your routine medical checkup from time to time, maybe twice a month, right? You check your high blood pressure using, you know, the high blood pressure monitor, right? Which the medical
armband.
Right, the medical people call it a sphygmomanometer.
Okay.
So a healthy lifestyle is critical in the prevention and management of high blood pressure.
A healthy lifestyle.
The way you live, what you do at your spare time is very critical.
From what I gathered, you have 6 floors here, and you also have a lift, but the lift isn't turned on until what time?
Until 10 a.m.
10 a.m.
10 a.m. in the morning, we resume here at 8 o'clock, but for 2 hours,
Everybody is forced to walk
up the staircase.
Even the people going to the 6th floor?
Even if you're going to the 6th floor or you're going down, and then the lift shuts at 5 o'clock so that when work is over, you don't take the lift down.
But you know, it's always easier going down than going up.
It's always easier going down, but you see, in the course of the day, you know, you just have to go up and down. Like I mentioned to you, we want to ensure that people around here maintain, you know, a healthy lifestyle by, you know, exercising from time to time. And so we also have a gym here in the office.
Oh, here on the premises?
Oh, yes.
Okay.
So we will see it, and then we will have a gym, you know, trainer that comes in, you know, every Friday, you know, to help with, you know, with the exercise regimen.
Okay, this is the gym here, second
Yes.
floor?
So you find it under recreational here.
Okay.
So it's just maintaining that, you know, work-life balance. You know, you play hard, you also work out.
Oh, this is great. This is great. And then you got a bit of a view outside as well.
You know, that helps you break the monotony when you're gymming.
I wish I brought my workout gear, because I enjoy working out from time to time. I wish I brought my gloves and my tracksuit.
How many days do you work out in a week?
To be honest, I don't work out as much as I should, but you know, I try at least three days, and then I cycle a lot. I ride my bicycle.
Oh, that's good.
At least 10 hours a week.
10 hours a week. Yes. Oh, awesome.
Yeah.
You know, I do about 3 kilometers a day. You know,
jogging?
Right on the treadmill.
On the treadmill.
And I do three days a week. So I try to make sure that at least I run, you know, between 9 and 10 kilometers a week.
Okay. Speaking of awareness, FIDSIN recently joined the World Health Organization in a global campaign against high blood pressure. Yet, despite such efforts by organizations like yours and others, awareness about this in Nigeria still seems to be at an all-time low. Why do you think this is the case?
Well, I think essentially, you know, the first thing is what I mentioned, right? There's a lot of myth, you know, around high blood pressure. You know, people feel because it is asymptomatic, I'm not feeling any symptoms.
So I must be okay.
So I must be okay. You ask people to go for medical checkup, they say, what is wrong with me? You know, they stretch out their hands like this, they say, I'm fit. You know, you don't measure fitness that way.
We seem to self-medicate a lot here in Nigeria, don't we? Could that be another factor?
Well, that's another factor because, you see, high blood pressure, one of the symptoms that will show up early is headache. So when a person has persistent headache, the first thing he thinks is I perhaps have malaria. He won't even think about high blood pressure. Right? Fatigue is another thing. You are getting fatigued frequently, you know, and you just think what you need is just vitamins. You won't go to your doctor.
I have a friend who has headaches every other day and takes Panadol at least 5 times a week. I guess I should drag him to go get tested to see well.
You see behind that, on that pack of Panadol, it says if symptoms persist for over 3 days, see a doctor. So when you're using Panadol or paracetamol for more than 3 days and the ailment persists, then you should see a doctor because there could be other causes of that condition.
I think I'm going to drag him to a hospital.
You better do.
It's not a laughing matter, but yeah.
You better do. You better do.
Now, the prevalence of high blood pressure seems to be quite high in low-income countries in Africa, with about 40% of adults in many African countries actually being affected. Could this be due to stress, as in could this be stress-induced or just poor dietary habits?
I think it's a combination of both.
Really?
Urban migration has brought with its attendant stress, you know, issues, right? Traffic stress, work-related stress, and all kinds, and all sorts. And then you also have the poor eating habit, right? You find the people at the lower, you know, income level, eating more, of red meat, foods with a high level of
really oily food.
Oily food, and this is quite damaging to the cardiovascular system. So I think it's a combination of both.
Mr. Olaye, thank you very much for your time, sir.
My pleasure.
You have a wonderful view of Lagos, by the way. Having spoken to several experts, I decided to get a real-life picture. So I spoke to somebody who has been living with high blood pressure and managing this condition for over 40 years. When did you become aware that you were hypertensive?
Well, I became aware of being hypertensive at my early age. When I was around that 30 years, I noticed I was hypertensive.
Wow. Do you have a family history of hypertension?
Well, we have that family history of being of hypertension, and it runs in the family.
Really?
Yes, it runs in the family, and actually there's nothing we can do about it, because we notice that almost everybody in the family goes through it.
So how do you cope on a day-to-day basis with high blood pressure?
Well, we cope with it. You take your drugs. That's the most important thing. Once you notice you are hypertensive, you should be taking your drugs regularly. And these drugs are not the same. They vary according to people. It's not always the same with everybody.
Do people have easy access to these drugs?
The drugs are there on the counter. You go there, you buy. Different types are there for anybody. If you are suffering from hypertension, the doctor will prescribe for you the type of drugs you will take. You don't just go to the counter to buy medicine.
Do you think the doctors and the hospitals and the government are helping enough?
They are helping enough, but there's one aspect of it they don't do. I think the government should be able to put all these high blood pressure machines all over the place, to make them available for people to check their BP all the time.
Make it more accessible.
It's very, very important. It's very, to me, I feel that people should actually place these machines everywhere so that it will be available for everybody to check.
Sure.
You could enter any shop, you could enter anywhere and check your BP.
While you're shopping, just check
your
blood pressure.
You check your BP and go away. Because I know that when you go to check BP, sometimes you will see that the BP is high. You will not even expect it, but it could be high.
Right.
And that means that you are hypertensive. A lot of people don't do that. And as a result, you see people dying. That is the cause of death for people.
Okay.
Because they don't check their BP.
So in your experience, how does one cope living with high blood pressure?
When you're hypertensive, you start taking your drugs regularly so that it doesn't go high. But check so that it doesn't go low again. So it could become a low pressure. Hypertension is not something to joke with. It's always good for people to know it, and then you take treatment. Low blood pressure is also bad. It kills. If it is too low, the doctor knows what to do about it. Having gone through it for so many years, as you're looking at me, I'm over 70 and I'm still living with it. I got this thing. I had it when I was 30 years.
Over 40 years ago?
Over 40 years I've been living with it. Just because I noticed it on time and I started taking my drugs religiously. Not today, take today, tomorrow you will not take. And checking it. If you are taking your drugs, of course you have to check whether it is going up or going down. I'm living with it, so people should not be afraid of it.
All right, Mrs. Awa, thank you very much for your time. Thank you.
Thank you. Thank you very much.
You're welcome. It is fast becoming clear to everyone that in Africa, infectious diseases have taken the attention away from our health managers and even the people themselves, leaving them open to the fatal claws of non-communicable silent killers like hypertension, which experts have said affects 4 in every 5 adults. However, such alarming statistics should not serve to create panic. Instead, it should serve to incite action. And act we should, because as healthcare professionals have shown us, with the right lifestyle changes such as working out regularly, a reduced salt and alcohol intake, a low-calorie and cholesterol diet, coupled with regular blood pressure checks, we can win this war against a silent enemy that threatens our collective existence as a people, nation, and continent. I'm James Layode, and until next episode on Channel Discovery, reminding you to live well, eat right, and remember, always check your blood pressure.